I believe that we as humans, we're all creatures of habits. For me, I have to start the day with a cup of coffee. And not only that, for the last 15 or 20 years, it's been the same brand. Why? No really good reason. It's just what I always got. Well, I firmly believe that your employees are creatures of habit too. And how they buy prescription drugs is costing them and you money. So today, I want to give you a couple tips about advice you can give to your employees about how they can save money when they buy prescription drugs in this episode of Healthcare Hacks. Hi, my name is John. I'm your healthcare hacker and a drinker of Folgers instant coffee. I know. Don't judge. I like the taste for some reason. Before we get started today, please take a minute, like this video, and follow Athos Health on your favorite social media platform, whether that's LinkedIn, Twitter, Instagram, Facebook, YouTube. We're on them all. By doing that, you'll stay up to date with our latest healthcare hacks and also help us reach more people because we want to get the message out there and how to navigate the complex U.S. healthcare system. Prescription drugs make up about 15 to 20% of the healthcare costs here in our country. It's a lot, and it's only growing. And so when you think about it, if you can find a way to lower that cost, your employees and you as an organization through premiums or direct to cost if you're self-insured would save a lot of money. So I'm going to give you 3 tips that you can pass on to your employees that hopefully they'll change their pattern for buying prescriptions and put more money in their pocket and improve the bottom line of your organization. The first one is really simple, but I'm guilty of this as much as anyone. It's shopping around. Talking about being creatures of habit, we tend to go to the same pharmacy to get our prescription filled. We never look and see, is there a cheaper place? We never price shop. Well, just by having employees price shop, they can save a ton of money potentially. Kind of depends upon your plan, but just have them take a minute and look and see where's the cheapest place. They can usually do that by logging on to the portal at their insurance company and shopping for the prescription costs. It'll save them money and it'll save you money. The second recommendation is somewhat similar, but a special case of shopping around. Just use a mail order pharmacy. Most plans now offer mail order pharmacies, and they're usually significantly cheaper than going to your local brick and mortar pharmacy to get your prescription filled. If you get employees to shift to that, they're going to save a significant amount of money, right? A lot of times I'm seeing it to be a third of the cost if you get a mail order pharmacy to fill your prescription than if you go to a local CVS, Walgreens. And that can add up. And not just for your employees, but then the year, when you're looking at your premium for next year, it's going to be a lot lower because you're going to spend a lot less money on prescription drugs. The third and final recommendation is, where possible, make the recommendation for people to explore using 90-day prescriptions. What's interesting is the cost per pill is not linear. It doesn't go up at 45-degree angle, right? You save more money the more you buy. So if you're getting a 90-day prescription, again, usually it's 10 to 25% less than if you bought 3 30-day prescriptions. Again, that adds up. Well, those are just 3 simple pieces of advice that you give to your employees that hopefully have an impact on their costs. Now, if you want to learn more, contact us at Athos Health. We do this for a living, and we can help you and your employees really hone what they're spending on prescription drugs and get the best possible deal by just using what's available to them. All right, I'm done with the self-promotion, but I wanted to cover just these simple ways that your employees can save a lot of money by just changing their habits on how they buy prescriptions. It's not that hard, and it can make a big difference. If you have any questions or comments, please leave them below. We're happy to address them in the future episode of Healthcare Hacks. We want to hear from you. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.